before electronic health records. Before electronic health records, it was a much more difficult time transferring doctors or even going to see a specialist. Before um, all the records were kept electronically, they used to be kept on paper, which I know is not a crazy idea. But whenever you're trying to go from doctor to doctor, your medical history stacks up. Eventually, you have a big stack of papers that you would have to keep up with. And if something happens where one of your papers gets destroyed or something, you could lose a couple years of health care right there, where doctors will not be able to access your information anymore. If that was your allergy sheet and you don't remember all of your allergies, then, or you're unconscious and can't tell them, then your allergies go unnoticed and ignored, which can be a life or death situation or just a very uncomfortable situation. If the emergency arose, you needed to go somewhere else other than your main care provider, and you didn't have these documents, then it could be an issue if you don't remember, or even if you are unconscious and cannot tell them. That is something that would be a problem. Um, the amount of papers that you would need to go transfer doctors or just go see a specialist would be a decent amount of papers, unless you're a young child and your parents are taking you, um, just so that they can make sure that they are treating you the best way possible. Now, with electronic health records, you don't have to take really anything except maybe a referral, but usually that's still sent online. All you need to go is with your insurance card and an ID. Whereas back then, you probably could have taken a stack of papers or could have had to go with at least a few documents saying what you're allergic to, saying your medical history, your immunizations, and all of that. This would have made for just a more annoying doctor visit. Nothing that's causing you not to go to the doctor or to go see a specialist, but something that can be annoying and making you not necessarily want to go. With EHRs, it's kind of gotten easier and made it almost painless to go see a doctor other than your main healthcare provider. They can easily access your files, whereas before you had to bring your files. So this helps. Definitely something that can agree with the introduction of electronic healthcare records. Definitely supports them being made.